All right, welcome everybody. My name's Aline Sigler and I'm with Provider Outreach and Education. Also on the line is my good friend and colleague Karen Curtis, who you'll hear from in just a few minutes. We also have a few members of our medical review and other staff to help us out today. So we're glad everybody could join us. Today we're focusing on errors that WPS is seeing in the submission of prior authorizations. And then we're troubleshooting, as the title alludes to, ways to prevent them. So if we talk about our goal with our objective and agenda here, we want to help you avoid technical and clerical errors that cause rejection of prior authorization requests. You'll achieve this by learning how to locate a list of services that are subject to prior authorizations. And then after that, we're going to review some of the errors that are occurring, things that we're seeing on a repetitive basis. And then we'll finish up with some resources where you can go to learn even more. So let's begin with some background information about which services are subject to Original Medicare's pre-authorization or pre-approval process. This webinar is not intended to be a start to finish discussion of the entire prior authorization process. If you're interested in that, I do invite you to check out the prior authorization playlist on our YouTube channel to view previous educational events on the subject. We did one recently on an overview of the whole process. And so if you're looking to increase your knowledge on the process overall, that would be a good option for you. Medicare only pre-approves a small list of certain services, and you see the two broad categories of services listed here. These include certain Part A hospital outpatient services. For these services, the hospital or facility, so the Part A provider, has to get the pre-authorization before the procedures happen. If you're the doctor or the professional, so the Part B provider, you can submit the paperwork for the hospital, but the approval is tied to the hospital's facility claim. It's for hospital outpatient departments. So if you're the Part B provider, you won't be putting that unique tracking number, we call it the UTN, because of course, Medicare has to have acronyms. You won't be putting that on your claim, but if the hospital doesn't get pre-approval, both the hospital's bill and the professional claim will be denied. After the request has been submitted, don't send your bill until you've confirmed with the hospital that their claim was approved and paid. So there is a partnership and a lot of communication that needs to take place in those situations. Pre-authorization is also required for repetitive, scheduled, non-emergent ambulance transports. That's a mouthful, so there's an acronym, RASNAT, R-S-N-A-T. That pre-authorization is also required if claims meet these specific criteria listed here. At least 6 one-way trips within any 10-day window, or at least 2 one-way trips per week for at least 3 weeks in a row. So first, let's start with the hospital outpatient department services. The prior authorization program is applicable to HOPDs, hospital outpatient departments, billing on a 1-3X type of bill. If you're watching this and you're a Part B provider, you don't have type of bill, so that might seem a little confusing for you. So we're speaking about hospital claims, facility institutional claims billed on the UB04 or the 837I electronic equivalent. And it's only for the types of services that you see listed here: blepharoplasty, botulinum toxin injections, paniculectomy, I knew I was going to stumble on that one, rhinoplasty, vein ablation, cervical fusion, implanted spinal neurotransmitters, and facet joint interventions. So each of these categories have one or more specific CPT codes that are subject to the prior authorization process. And I think this seems to be one of our levels of confusion here, because providers look at these categories and think that it's all facet joint interventions or it's all rhinoplasty services. But there is a list of specific CPT codes that are subject to this prior authorization process. Any other services performed in the hospital outpatient department, even though they're billed on a 1-3X type of bill, or any service that's performed anywhere outside of the hospital outpatient department, is not required nor eligible for prior authorization. And so I think that is where some of our errors come from. Moving on. So how do we know whether or not the services that's planned for our patient requires prior authorization? Well, we have an article on our website, for one, that can help you. There's a screenshot of it here, and there's a link to it on your resources slides as well, which are towards the end of the slide deck if you haven't looked at it yet. So I'd like to go out there real quickly. As you can see, once we get out to the website, take it just a second to load the page here. Once we get out there, as you can see in the, it lists each of the categories of services, those ones that we just looked at that were listed on that previous slide. So it has the effective dates, when they became part of the prior authorization process and such. And then as we move down a little farther, just as an example, happens to be the first one we come across here. It gives a list of those affected HCPCS or CPT codes. It gives suggested types of documentation to include. It also contains links to applicable local coverage determinations and CMS internet-only manuals, depending on what the service is. And then you'll also find forms and other WPS resources. After it lists all the different services, continue to scroll down, and I know a lot of scrolling, so look away. Details. View information. What sort? I go out. Add something in need. Those motivate me. The prior authorization requests. So we're going to jump back to the PowerPoint now. I see a chat saying that the audio connection is not good. I apologize for that. I'll try to speak more slowly. Thanks, Connie. Thanks, Vivian, for that information. As we go to the next slide then, while it's true that the majority of the prior authorizations that we receive are for the hospital outpatient department services that we just mentioned, we also need to talk about the repetitive scheduled non-emergent ambulance transport. Now, like our last slide, we also have a screenshot and a hyperlink to that web page that's dedicated to this topic, where you can find information about that program and what is expected. So as we open up that resource, it has some of this information, the effective dates, the applicable HCPCS codes, documentation and submission guidance, such as what to include and where to send it. It gives you an overview. Yes. Before. You may not have even known that we had it. So this is another case where I encourage you to go out, take a look bookmark it if it's something that you're going to need to refer to, train other people on, whatever the case may be. So as we go back to the PowerPoint, I'm going to turn things over to, like I said, my friend and colleague. I love her so much. Turn things over to Karen. She's going to go over the next portion of the presentation with you. Karen, go ahead.
Thank you so much, Elaine. Hello, everyone. My name is Karen Curtis, and I am also a member of the Provider Outreach and Education team. Elaine and I took time and met with some members of the medical review team because we wanted to know what types of issues they are seeing. This allowed us to see where education was needed and how we could hopefully make the process easier for everyone involved. Now, here are the top reasons for rejections, and this is all based on information that's been collected by our medical review department, and this has happened just so far this year of 2026. So the number one reason for rejection is that the codes are not part of the prior authorization project. Elaine provided you with a couple of WPS resources where you can find the services that are included in the prior authorization project. And as we took a look at those, you could see it actually lists the specific HCPC and CPT codes. So hopefully those resources will help you know, should I be submitting a prior authorization request for this service, or, is it something that's not needed? Next, we have the Part A PTAN number is invalid. So here we're talking about that 6-digit number that's assigned by WPS when a provider enrolls. Coming in at number 3 is the provider is exempt from prior authorization. I'll talk a little bit more about this later, but when providers have been made aware that they are exempt from the prior authorization process, then they don't need to continue to submit those requests. Like I said, we're going to get into that in a little bit more detail in just a little bit. Part A facility MPI number is invalid. This comes in at number 4. Now, MPIs are that 10-digit number, and those are issued by the National Plan and Provider Enumeration System. So it's referred to as the NPPES. At number 5, we have the Part A facilities PTAN number was not provided. The majority of the other rejections that are not listed here also had to do with missing or invalid information for both the Part B physician information and the beneficiary information. So we're kind of going to look at these a little bit closer, a little bit more detailed level, because we want to help you understand what's needed so that you don't continue to get these rejections. Now, I realize that not everyone may be registered for the WPS SecureNet Access Portal, and you may also hear this referred to as SNAP or simply the portal. But I did want to show you how the portal's prior authorization function kind of helps you make sure that you're only submitting a request for services that are within the program. So in this example, I've selected a Part A NPI from the service location dropdown. And when I move to the Type A PA field, the drop-down box is going to show me a list of services that are subject to the Hospital Outpatient Department, or HOPD Prior Authorization Program. So that's going to start me out by giving me a list of services that I get to pick from. Then as I move down that form to the additional information portion, the type of bill is going to be auto-populated as a 13X. So this is something that Elaine mentioned earlier, that 13X is for the Part A or the institutional claim. And when I select the drop-down box for the HCPC or the CPT codes, The portal is going to provide me with a list of codes that's associated with that service that I put in the prior authorization field. So if you don't see the service or the codes that you're trying to submit a request for, this is going to allow you to double check and see if a request is really necessary. There's no reason to add extra work for yourself or for WPS staff. Now, if a Part B NPI is added into that service location field, then the only option available in the type of PA dropdown is going to be for the repetitive scheduled non-emergent ambulance transport. Um, Aline mentioned that earlier too. We have those separated into Part A and Part B services. And even though Part B services can request prior authorization for the facility, it would not be able to be done through the portal unless you have access to that Part A facility's NPI. I know we have a lot of providers that say that they bill for both Part A and Part B, so it's all going to depend on what your situation is. So if I do pick for that RASNAT for the type of prior authorization, then when I get to the additional information portion of the form, the HCPC or the CPT field drop down, I'm only going to have the two RASNAT codes to choose from. Now, if you would like to learn more about submitting prior authorization requests using the portal, I did hold a webinar in January of this year on the topic, so the recording can be found on our YouTube channel. Now, since we had 3 different rejections that were related to Part A information either being invalid or missing, I kind of grouped these together. Well, since the portal auto-populates much of that information, I wanted to include some information about filling out the paper form, which you can see here on the right. We do get requests sent through fax, so this paper form would be an option that would be sent in with that. We are going to go, this is actually a link to our website, so let's go and take a look at that. Okay, so as you can see at the very top, we have all of the regions listed at the top along with a fax number. So that's where you're going to start out with picking what jurisdiction you're in, and then it has the fax number provided of where you're going to send this. The area where the errors are occurring is within the facility information. So when we look at this section right here, facility information should be completed using the information where the services are going to be performed. So for example, this is going to be the hospital's PTAN and their NPI, their name and address, and their fax number. For the physician practitioner information section, our medical review department has reported rejections due to the physician's NPI either being invalid or it not being provided. You'll also want to make sure that the physician or the practitioner's name listed on the form matches the name that the NPI was issued to. That was another error that they've run into. Then when we move down to the beneficiary information, there were a few rejections from this section of the form. Medical review department needs the patient's NBI number, which is sometimes missing or invalid. Another thing that you're going to want to make sure to do is anytime that you're dealing with Medicare, make sure that the beneficiary's name matches what is shown on their Medicare card. So if the patient goes by Kenny, but his Medicare card lists his name as Kenneth, then you're going to want to make sure to use the name Kenneth when you're submitting services and documentation to Medicare. So when you're filling out this beneficiary information on this form, you're going to want to make sure that that MBI is what's shown on the card and that the beneficiary's first and last name is also matching that card. Let's go back. So now we're going to talk a little bit about requests from exempt providers. This was our number 3 top rejection, but since the process is a little different, I wanted to pull it out separately and talk about it separately. So exemption from the prior authorization process applies to all hospital outpatient department services. To qualify, a provider must show that they are in compliance with Medicare coverage, coding, and payment rules related to these services. This is done by submitting at least 10 prior authorization requests during a review period and achieving a compliance rate of at least 90%. Providers who meet the criteria will receive a notice of exemption, and they're going to get that at least 60 days prior to the effective date. This exemption will remain in effect for 12 months, but providers do need to be aware that CMS can decide to withdraw the exemption. If that occurs, notification will be provided 60 days prior to when that exemption is going to end. If you are a Part B provider that is submitting a prior authorization request on behalf of the hospital outpatient department, you're going to need to contact them to make sure you're aware of their exemption status. If they state that they are exempt, request a copy of the exemption notification letter. I mean, that'd be something that you're going to have on file too if you're submitting those requests for them. Exempt providers are also given the option to opt out of the exemption process. If they choose to do so, they will need to start submitting prior authorization requests again. So as you can see, there has to be a lot of communication when it comes to this whole process. Exempt providers will be asked to submit a 10-claim sample to determine if they will remain exempt or if they will return to the standard process. Now, exemption status can be checked within our portal. For people who are standard users and or MPI administrators, there is an option located on the transaction card on the home page. I've outlined the option here. Now, in order to review these letters, you will need to have the hospital's MPI listed in your applicable service locations. The portal will display both exemption and withdrawal from exemption letters. The results can be filtered by letter type, PTAN, MPI, and letter date. This function was also covered in my January webinar if you'd like to have more information on that. And here I wanted to show you an image of what the prior authorization exemption screen looks like. I only have access to the portal test environment, so these aren't real examples. You can see that both exemption and withdrawal letters are going to appear. In the upper left corner, there's a drop-down box to select letter type. So if you quickly want to see if a withdrawal from exemption letter has been issued, then that could be a quick way to narrow down your results. Under the Actions header, you can see an eye icon. Clicking on this icon is going to allow you to view that letter. Again, since I don't have access to the production environment, I'm not able to show you examples of what those look like, so I apologize for that. Now, we do want to provide you with a few resources to help you with the process. WPS does have a prior authorization playlist. Aline brought that up earlier on our YouTube channel, and I am going to have Aline add a link into the chat. She also mentioned that 2 weeks ago, a member of our clinical staff held a webinar titled Prior Authorization Overview. Now, if you're not able to access YouTube on your work computer, that particular webinar is still available on our Encore Presentations webpage. So I wanted to show you a few of these resources. We won't look at all of them because Aline already covered some, but this very first one that we have up here, the prior authorization, this is a WPS resource, and it does give you an overview on the prior authorization process. It lists the Part A services, and then it also lists the Part B services. Here you can find links to those pages that Aline covered earlier. It also down at the bottom here gives you some information if you're wondering about benefits or coverage and you don't see the codes or the service listed anywhere. So it provides you a link with the national and local coverage determination lookup tool. So that way you can be like, well, it's not subject to prior authorization, but is there other guidance that is telling me what's covered and what's medically necessary that you need to look at and review for help. It also explains that for coverage for services that are not subject to prior authorization, those are going to be based on medical necessity. And it also provides tools for more coverage as you go down. We'll go back. So the prior authorization for the HOPD and also for the RASNAT, those were the two that we looked at earlier, but we wanted to provide you with separate links. Here is the outpatient, the form that we went through. This is a little different because it takes you to the page where you can download it. Notice here I'm in Part B, and you have a warning saying that this resource applies to Part A or J5A and J8A regions. So we're going to switch over to J5A. We'll see that warning goes away. Here's the link to the overview. It gives you the addresses that you are going to want to send your request to. So you'll want to make sure you're in the right jurisdiction. And you'll also notice that if you are using a delivery service, that email address, or I'm sorry, that physical address is different. So that's another thing you'll want to notice. Again, it also gives you a fax number, and then you could download the form. Now for additional resources, this top link, the prior authorization exemption process, this provides an overview of the prior authorization process. It also provides a timeline, a quick overview, and a detailed overview. And then if you scroll down to the bottom, it has a lot of frequently asked questions for the exemption process. So if you have more questions about the exemption process, remember that was in our top errors, here's some information that can provide you with some answers to that. Oops, sorry about that. The prior authorization program for certain hospital outpatient department services operational guide. This is a CMS resource. So we wanted to provide you with a couple CMS resources also. This is pretty lengthy, so I'm not going to go through the whole thing, but I did want to call your attention to page 6. It gives you initial submission documentation. So CMS is providing you with a list of information that you're going to want to make sure to include. It also talks about resubmission documentation. And it gives you addresses for the MACs, their contact information. So I did want to call your attention to that because that's provided by CMS. And then the last resource that we have on here is the prior authorization process for certain outpatient department services frequently asked questions. This is also a CMS document. Go back up to page 1. And they took their frequently asked questions and they broke it into different categories. So you can see here, the first section is just prior authorization general questions. I won't go through the whole thing, but as we move down, Sorry, I'm trying to scroll a little slower for those of you that it may bother. It goes into the prior authorization process. There's a whole section on UTINs. I know in the past claim errors there's been problems with claims because the UTNs were not included on the claim. So that would be a section that could be interesting for some of you. Other sections include the exemption process as well as claim submission and processing. So we just wanted to provide you with as much information as we could to help you with this whole process. Now, as we go back to the presentation, I'm going to turn things back over to Aline, and we're going to go through some questions and answers.
Thanks, Karen. Thanks for showing us some of those great resources. And they're really good resources because if we have a question, chances are someone else has had that question. And so it's good to use those to learn more. Now, we did receive several questions during the registration process. So I want to go over those first. We received a couple questions that were about the appeals process and submitting appeals, and that's not something that's part of this webinar today. We do have an appeals playlist if you'd like to check out previous education on that topic. We also had a couple questions specifically asking about authorizations for Medicare Advantage plans. Those are totally separate from what we do with traditional fee-for-service or original Medicare, so we can't answer those questions, unfortunately. You'd have to inquire with the individual plans to know what services they require authorization for. We did get a question, though, does WPS provide retro authorizations? If so, what is the time frame? A few people asked this and similar questions. In a nutshell, the answer is no. A prior authorization request has to be submitted before the service is provided to a beneficiary. However, with a lot of things in Medicare, there are exceptions, and the exception would be in the event that the place of service is a procedure requiring a prior authorization in the hospital outpatient department emergency room. Then WPS will issue a retroactive decision. The hospital outpatient department should submit a prior authorization request to our office within 2 business days. And you're going to mark the prior authorization request as expedited with a reason of emergency room place of service. So that's going to get our attention, and then WPS will review that prior authorization request and issue a decision within 2 business days. Our next question: how do I submit provider-based charges that require the hospital-based side to have obtained the authorization for services? And the answer to that is to confirm with the hospital that their claim was approved and paid. If so, then you can bill your Part B claim. Next question we received during registration: is the prior auth only valid for one service date, even though there is a date span? We were under the assumption that the auth was valid for the whole date span, whether it be 2 or 3 visits within that date span. But it doesn't appear that this is the case. We are receiving denials, and it seems as if the auth number is only appropriate for one service date. We're looking for clarification to see if our auth team should be getting a new auth number for every date of service. I know that was a little long, but I didn't want to change the content of their question. I did notice that this question was submitted by a hospital. So yes, each unique tracking number is valid for one claim. It's true that the affirmation UTN is valid for 120 days, and I know that's outside of what we're talking about today, but a provider cannot bill for multiple dates of service under one prior authorization request or each UTN. Each procedure requires a new prior authorization request, regardless of whether the next service falls within that 120 days. And you can actually see that answer or a similar answer in those frequently asked questions that Karen just showed you. Next question. What is the key factor you're looking for to support a UTN for ambulance? And the answer to that is the documentation needs to support that the beneficiary's medical condition is such that other means of transportation are contraindicated. The documentation should also support that the beneficiary's condition requires both the ambulance transportation itself and the level of service that's provided for the billed service to be considered necessary. Next question. How does our facility know about exemptions? Nothing is listed since 2021. Now, I'm not sure what you mean by listed, but we have guidelines and timelines for the exemption process, and that notification withdrawal information located on our website, and that article Karen showed you, also in the operational guide. I do recommend, if you are not a registered user of our portal, that you get that. And then you can look for the links to those two resources in those resource slides. If you're listening to this as an encore, look for the links to all those resources in the description of the video. Next question. The importance of obtaining the prior authorization in a timely manner. Now, this is more of a statement rather than a question, but what I can tell you is upon receipt of a prior authorization request, we meaning the MAC, will review and issue a decision within 7 calendar days. The last two that were submitted, I'm just going to read them to you. How to prevent non-affirmations when Medicare has all the information, and what is the big deal with facet injections? Now, these are really both going to depend on the specific claim and situation. So if you sent these questions in, my advice is to contact our office. If you need more information or you wish for them to look at a claim or walk through a situation with you, I can't really answer those. I do want to thank everybody who submitted questions during registration. Now I'm going to look at the ones in the chat to see that what we have that's related. And the two that I see are similar. One's from Casey, one's from Angie. So I'll read it and then I'll open it up to see if any of our experts on the line can provide insight to us. Our claims are denying for no prior auth, but we have an approved authorization on file and the facility claim paid. But the providers, the doctor's claims, are denying for no prior authorization. Why do they continue to deny if we have approved authorization and the facility claim paid? We appeal them and they deny. It takes all the way up to the ALJ, which is the third level of appeal, for these claims to get paid. So does anybody on our staff have an answer or can provide input to these two questions?
I would like to see some claim information to give you a specific answer for that. My name is Amanda and I'm in the appeals department. But to see why exactly we would have found it unfavorable on your appeal request, I would need to see the specific claim data. And since we can't share that in chat, if you could reach out to Aline and Karen after the webinar and provide them with that information, then I can get a response back to you on why we found an unfavorable decision and some clarification on that.
Thank you. So what we'll do, go ahead.
Hi. Just to add to what Amanda said, so I'm also in appeals and I am no expert in the prior auth process. However, my understanding is that the prior auth is, even when you get a prior auth, it is still subject to medical necessity. The services still need to be billed with appropriate diagnosis codes. And so I think that could be one possible reason So I just wanted to add that, but like Amanda said, having specific examples, we would be able to give a better answer.
Thank you. I appreciate your input so much. I did just drop the email address for Poe in the chat again. Reminder there not to send any PHI or PII, but some contact information would be helpful, and we can look at those situations. So since Casey and Angie's questions were very similar, we'll leave that there. I don't see any other questions in the chat, so we're going to move on. And what we'd like you to do is please take a few minutes to complete a survey about this course. That way you can tell us what you liked, what we can do better moving forward, and give us suggestions for future educational topics. You do have a few options depending on your preference. You can use the link that I'm going to place in the chat. Or when you exit the webinar, you're going to be asked to go to an external site. And that external site is the Qualtrics site for the CMS survey. It's not going to be anything malicious. It's going to look similar to the box you see on the screen with the triangle and the continue button. And that's just going to take you right out and launch that survey once you hit that continue button. If you're listening to this course as an encore, you're going to get a box that's going to look similar to that other picture on this slide. It's going to have the hand and the stars, and that will take you out to the survey. However you choose to do that, don't hesitate to give us your honest feedback. Those surveys are the only way that we know how we're doing, and then also give us the types of education that you're interested in. In a few minutes, you're going to receive an email that's going to thank you for attending. We don't want you to delete it without reading it. If you haven't seen it before, you're not familiar with our process, this email contains a link to the survey, but it also contains your certificate of achievement. It has your name and your contact hours. So if you need to turn it in for continuing education units, you can do that. Now, if you don't see it, make sure to add the WebEx email address to your safe sender list. And I'll add it in the chat just so you can see what it is and you can recognize it. If you think of another question related to today's topic, you have 1 week to send those in. That's 1 week from today, the live event. And then you can send them to our same email education box. I've added it here. And just add something about prior authorizations or prior authorization errors in the subject line so that they'll come to us and we can forward them on, do some research, and provide an answer for you. I want to thank you for your participation today. Thanks to all of our panel also for your help today. We hope to have you join us for future educational events. We look forward to that survey feedback, so please complete that survey for us. And you may now disconnect. Have a great rest of your day, everybody.